Thank you. So my name's Abby. I'm here to talk about the Cancer Prehabilitation Trust, or Cancer Prehabilitation Service. So we're just going to focus at the moment on where we started, which was with our patient partners. So right from the outside, when we very first launched, we worked with two patient partners who both have lived experience of cancer, both from very different backgrounds with very different experiences, and this is their account of how it felt working with us. It was challenging at times. Sometimes it was quite difficult to listen to because there's not always things that we do right and haven't done right in the past. But one of the things that jumped out at me in this feedback was particularly around Robin's comment, which was he hadn't really felt that he had been listened to until he'd met our team, and he really felt the NHS was listening, and that was what we were trying to do. We were trying to listen to what our patients wanted and not what we thought was needed. So this is just some headlines around the outcomes of the prehab service, and what we focus on is whether we can get the patients home quicker. So for us as a trust, we're very much the shorter length of stay our patients have, then obviously we can get more patients through that bed stock. But actually for a patient, it's about how quickly they can get home, whether they can get home to their loved ones, and we know sort of pets, we know that they recover much quicker at home. We also know that quality of life is really important, and if they are able to be more physically active, they're much likely to recover quicker, and less number of admissions that we've seen, particularly in our prehab population. This is a slide where we've got an imaginary patient, Peter, but the scenarios here that we describe are all scenarios that we have seen within our prehab service. So we describe the impacts to a number of different people. So firstly, to Peter himself. So for example, by making him fitter and more active, we were actually able to reduce and actually get him off his crutches. We found that he was able to engage better, and he had some psychological support that he'd not had before. And actually that carried over as he'd lost his wife. So we're thinking about how we can affect the whole of the patient. It's not just the physical, it's the psychological well-being of these patients. But from a trust point of view, I've touched on it, we can reduce length of stay, which means we have more patients going through our bed stock, and we can have a wider impact. We see less post-op complications, which again have a massive impact for us as a trust. And we've seen less readmissions or ED attendances. For the wider ICS and population health, we often find that these patients, with the help of our partners, are able to integrate into society. We give them that support network that they require to help carry on and live life with and beyond cancer, which is really important for that. This is just some of the patient feedback that we've had and that we've received with the service, and what I'll introduce you now is Kerry and Rose from Self Help UK, are our social prescribing link workers, and they're going to talk you through a case study of a patient that we've had through the service.
Thank you. Just want to say I'm a little bit nervous. I haven't prepared for this, but I did want to share with you a story of one of the patients that I looked after. Myself and Kerry, we obviously partner with this service, and we're from Self Help UK. We're also Macmillan professionals. The idea is obviously the clinical team will look after all the clinical needs of the patient, and then we've also got the exercise professionals that will take care of that. But then often the clients will get home, the patients will get home, and they will ask themselves, what now? Who's going to support me now? And that's the role of the link worker. We put that patient right at the centre of what it is that matters to them, and they are the most important person that will lead on what they need. The example is of my client Ronnie, who had absolutely crippling anxiety, almost to the point of agoraphobia. This actually became more apparent when she received a diagnosis of lung cancer. However, she was on a pathway where appointments were made, she had a surgical date, and that was all going on, and she was just going along with the tide. She was referred to the link worker, for which I was given her as my patient to look after. I went out to visit her because I realised she had high levels of anxiety and a home visit would probably be better in this case. When I got there, what she was telling me is that she just needed everything to stop. Just can't do the surgery, there's too much going on, and needed somebody to listen to her. And that's something that myself and Kerry have, that we appreciate that a lot of clinicians don't have the time. So I spent a lot of time with Ronnie, created a care plan, a person-centred care plan that looked at her emotional concerns, financial, spiritual, family concerns, and we came up with a plan. Now, because we're with Self-Help UK and we're part of a wider service as well, we also have the luxury of around 60 to 70 trained Macmillan volunteers. They also help support Ronnie by, one of them in particular spent 9 hours with her in one day, accompanying her to her pre-op appointment that she never ever would have got to otherwise. Needless to say, the end of this story is that she just needed somebody outside of the clinical team to listen to what her needs were and put her at the centre and just help work with her with that. She did go for a surgery with the help of her care plan and the support that we provided. She is now cancer-free and she's living the rest of her life.
And I think what sums that up is that there is a real association with mind and body, and we are, in healthcare, particularly in the NHS, we're very much focused on the medical model, and whilst that's really important and where our expertise lies, what we need to make sure we keep in the forefront of our mind is there's a person associated with that, and all the other social and mental and psychological requirements that patients have. It's really important to utilise our partners and our support networks to make the best for our patients. And sometimes the medical management isn't the most important, it's looking at the other needs. Thank you.
Wow.